Encephalitis, also known as brain inflammation, is a condition characterized by the inflammation of the brain. It can be caused by various factors, including viral infections, bacterial infections, and autoimmune disorders. This guide will explore the causes, symptoms, and treatment options for encephalitis. Types of encephalitis. Encephalitis can be classified into different types based on the underlying cause. The most common types include viral encephalitis, bacterial encephalitis, and autoimmune encephalitis. Viral encephalitis. Viral encephalitis is caused by a viral infection, with a herpes simplex virus, HSV, Japanese encephalitis virus, and West Nile virus being the most common culprits. These viruses can invade the brain and cause inflammation, leading to encephalitis. Bacterial encephalitis. Bacterial encephalitis occurs when bacteria infect the brain. Common bacteria that can cause encephalitis include Streptococcus pneumoniae and Haemophilus influenza. Bacterial encephalitis is usually a result of a bacterial infection in another part of the body that spreads to the brain. Autoimmune encephalitis. Autoimmune encephalitis is a condition in which the immune system mistakenly attacks the brain, leading to inflammation. This type of encephalitis is often associated with antibodies targeting specific proteins in the brain, such as NMDA receptors. Symptoms of encephalitis. The symptoms of encephalitis can vary depending on the underlying cause and the severity of the inflammation. Common symptoms include fever, headache, confusion, seizures. These symptoms can develop gradually or appear suddenly, and they may worsen over time. In severe cases, encephalitis can lead to neurological complications and long-term effects. Complications of encephalitis. Encephalitis can have various complications, especially if it is not diagnosed and treated promptly. One of the most significant complications is brain damage, which can cause long-term neurological impairments, including cognitive deficits, memory problems, and motor dysfunction. Diagnosis of encephalitis. Diagnosing encephalitis involves a combination of medical history evaluation, physical examination, and laboratory tests. One of the key diagnostic procedures is a lumbar puncture, also known as a spinal tap, which involves collecting cerebrospinal fluid to check for signs of infection or inflammation in the brain. Treatment of encephalitis. The treatment of encephalitis aims to reduce inflammation, manage symptoms, and prevent complications. The specific treatment approach depends on the cause of encephalitis. Viral encephalitis treatment. Antiviral medications are commonly prescribed to treat viral encephalitis caused by viruses like HSV, Japanese encephalitis virus, or West Nile virus. These medications help to suppress the viral replication and reduce inflammation in the brain. Bacterial encephalitis treatment. Bacterial encephalitis requires prompt treatment with antibiotics to eliminate the bacteria causing the infection. The choice of antibiotics depends on the specific bacteria involved and their susceptibility to different medications. Autoimmune encephalitis treatment. Treating autoimmune encephalitis often involves immunosuppressive therapies to control the autoimmune response and reduce inflammation. These treatments may include corticosteroids, intravenous immunoglobulin, IVIG, or plasma exchange. Supportive care. In addition to specific treatments, supportive care is essential for managing encephalitis. This may involve providing medications to control fever, pain, and seizures, as well as ensuring adequate hydration and nutrition. In severe cases, hospitalization and intensive care may be required. Conclusion. Encephalitis is a serious condition characterized by brain inflammation. It can be caused by viral or bacterial infections, as well as autoimmune disorders. Recognizing the symptoms of encephalitis and seeking prompt medical attention is crucial to prevent complications and ensure appropriate treatment. If you or someone you know experiences symptoms of encephalitis, it is important to consult a healthcare professional for an accurate diagnosis and appropriate management.